Good morning or good afternoon or good evening, wherever you are watching this. Trying to think, it's noon here in Florida. I don't know, it's afternoon, I believe, in across the pond, where I'm very, very fortunate to welcome a friend. Dr. Malin Regardt is a outstanding occupational therapist who I've known for many years, and all of my time at TMA. She's an expert basically on hand work. In myositis, she also does research in systemic sclerosis at arguably one of the best places I've ever seen for myositis work. It's called the Karolinska University, where she's worked for in Stockholm, where she's worked for over 20 years. In addition to being a clinician, she's published 17 articles, or has, I think, 17 articles in that area. So she really is an expert on the importance of hand therapy, outcome studies, and how hand issues affect people's livelihood. So at this point, I would like to, without further ado, turn it over to Malin.
Thank you very much, and also for the invitation to see you all. So that's true. I'm working at Karolinska, and unfortunately, my invitation for the Nobel Prize dinner, which is on the 10th of December, got lost in the email. So I'm here with you instead, which I'm glad about. So I will share my screen as soon as I do it correctly. And then like this.
Perfect.
Yep. Good.
Yep.
Thank you. So I'm Malin Regardt. I'm an occupational therapist, as was said. I'm a PhD, and I also do research, and I work at Karolinska University Hospital and also Karolinska Institute. So just to get a picture on where I am, so you see the red dot in the upper corner here is where I am. And here is where you are. I work at this really new fashionable hospital and also at KI. So, and I live in a little island outside Stockholm, but there is also where the king lives, king and queen. So, yeah, we're not really neighbors, but still, it would be nice. So I would like today to present a pilot study that we have done on the Carbonhand, and I will tell you about what that is. And I will also talk about hand function and hand exercise in myositis. We know that hand function is important in your daily activities because they're your tools. And we also know that in IBM, there is a problem with reduced hand function that leads to limitation in daily activities. And we see that there is an urgent need to develop some kind of therapies or assistive devices, which this is, to improve everyday function and quality of life in people with IBM. So I have not developed this glove that I will show you. It's a company that have made it. They have some features that we thought would be beneficial for people with IBM. So the aim of the study was to investigate if the power enhancing glove, this Carbonhand, is feasible to use in persons with IBM. So the green lines where you can see acts like tendons. So when you initiate pressure on these dots, green dots, it will help you get the grip. Yeah. So it's a glove. You have it on either hand, and you also have like a battery on your back or around your waist or as a backpack. And it's an intention detection logic that reacts when initiated. I don't really see myself, but I guess you see. So when it starts to press on those dots that were on the picture before, it helps you to maintain or increase the grip. Yeah. So thankful, thanks to TMA, we were able to do data collection during the conference in San Diego in 2023. It was Helena Alexandersson, my colleague at Karolinska, and Annika and Theresia from the company that develops Carbonhand, Bioservo, it's the company called. We were sort of in the lobby. We actually had rooms that we could be in, and inviting people that were participating in the annual patient conference to meet us in the room and try out the glove. We do have some data on other myositis than IBM, but they were only like 10 people, so we haven't really looked into that data yet. So this will only be on IBM. So those who participated answered a few questionnaires about physical function. They answered a questionnaire about quality of life, and we also measured grip strength, which is the one. I guess you might have seen this before in the clinic. So every participant got to choose 3 activities that they wanted to, or that they thought they had difficulty performing. And they rated their perceived performance without the glove and with the glove on this scale from 4 to 0, where 4 is without any difficulty and 0 is that they were unable to do. So luckily enough, we had 40 people participating. They were between 60 and 70 years of age. They were approximately the same amount of women and men. So the IBM FRS, you should have a high score if you have full function. So the physical function was rated a bit low, and that was the same for the PRO UEFS, upper extremity function scale, was also rated quite low. On the other hand, the quality of life was in the middle of the higher area. Grip strength were quite low of those who participated. I guess you don't really use kilograms, and I'm not sure what it is in pounds, but we have a study that is made in Sweden many years ago, and they say that you need approximately 6 kilograms to vacuum clean. So these were, and that is something that you can use, of course, if you don't want to, but yeah. So those that participated had quite a lot of imitation, but also reduced hand function, which were the ones that we wanted to test the glove. So these are the activities that the patients or the participants chose, or they were most commonly selected. So they were free weights, the thing that you use in the gym. Previously open jars, because when you open it was just open, so we couldn't really have new jars for every person. Lift a heavy bag from the floor, holding a frying pan, but also picking up a coin from the table. And all of these activities were improved while they were using the gloves. So if you look at the numbers, so 0 indicated unable to do, but 4 were without any difficulty. So the median value with the glove were close to without any difficulty, or 4 on the score. The activities in the first 4 activities is activities that you usually use the grasp grip, or you use the whole hand, which we were expecting to be improved because that is kind of the thing the glove does. So we were a bit surprised that picking a coin from the table was actually improved. Not that much as the others, but still. And So I don't know if you remember, but the sensors were on the middle finger. And I guess usually when you pick up stuff from the table, it's usually with your index finger, but it could be that they chose to use the middle finger because it helped with the flexion. Not really sure. But I think it was interesting. So not only the grasp grips, but also a little bit of the fine motor skills could be improved. They were also asked to answer open-ended questions. So I would say everybody thought it was beneficial for them to use in everyday activities, like those heavy stuff that you do. And that it also would increase independence, which I think feels good in the heart, because even though that you're not independent, that if it could increase independence, it's something that we should aim for. Most of them did not foresee activities that it would not work. Some thought it might be difficult to use it in personal hygiene activities because it would be in a wet environment, and also social activities, because when you use the glove, there were a little bit of this battery sounds like wee, 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 wee. But if you're in a room with other noises or people talking, you wouldn't probably be disturbed about it, but it was a little bit of a sound from the battery. We could also see that those that had only little limitation in the hand function thought it would be more beneficial if the hand function were more limited, because it could be a little bit of a hassle to put that on, because you have the battery and you have the cords, even though that didn't got entangled or anything. That was not really the problem, but I guess it's like any aid or assistive device or splint or anything that you use. If you have enough problem or enough help with the device, you would use it. If it's just a little bit of help, you wouldn't use it anyway. We could also see that those who had severe limitation in the hand function, and especially in combination with reduced arm strength, they were not helped in the activities by the glove. So we think we can conclude that the glove appears to increase hand function and might improve physical function. This was just trying out the glove in 3 activities in the lobby during the annual patient conference. But we could also see that those with severe limitation in combination with reduced function in the arm might not benefit of the glove in daily activities. We're planning to do an intervention study to see if the usefulness of the glove, and it's important. They're supposed to use the glove for 6 weeks in daily activities that they choose in their home, and see if. So the hypothesis is that it would improve physical function or activity limitation in the activities that they can perform the activities, but we also hope that if you use the glove, you might use your hands more, and it might also increase hand function, but we don't know, but we think that it might be a possibility. So I will continue with the hand function in myositis. So I have done studies on polymyositis, dermatomyositis, and also inclusion body myositis. I know there are a lot of more myositis kinds, but they were not really, I wouldn't say invented, but they were not as commonly described when I did these studies. So in the literature in poly and dermatomyositis, they say that it might be present in the late phase of disease. What we could see when I did my PhD was that the grip strength were reduced already in the beginning of the disease. Otherwise, poly and dermatomyositis were said as a that the grip function wouldn't be reduced. Really, it's more of those other muscles closer to the body. We could see that the women had approximately 71% of what is normal of the general population, and men 60%, and that the reduced grip strength had were associated to domestic activities and quality of life. In inclusion body myositis, it's more commonly described that the muscle function in the hands are reduced, and the finger flexors are affected, which could lead to an altered grip, but it could also lead to what do you call it, that you get stiff also in the joints, even though it's not an inflammation in the joints. But since the muscles can't flex the fingers, you might be stiff in your joints because you don't move them. There is also reports of reduced dexterity or fine motor skills. In the cohort that we had, the women had approximately 42% of what is normal, and men 30%. And the grip strengths were associated to daily activities and quality of life. So I added this because, so why do we really need to exercise the hands? I mean, the physical therapists say that we should exercise all the other stuff. Isn't that enough? But I would say that the hands are our tools in daily activities. And it is important to maintain or improve the hand function so that you can continue doing the things that you want to do in your daily life. So we did a hand exercise study, a 12-week hand exercise study for poly and dermatomyositis. We did measures before and after. They were supposed to exercise 3 times a week. We included 11 participants. They were very nice and did almost all the sessions with hand exercise that we prescribed. We could see on a group level an increase of the 3-jaw pinch grip in the left hand. But there were also some individual improvements in hand function and activities. So one of the participants said that now I can take 2 plates from the dishwasher at the same time, which is, I think, as an occupational therapy, is a therapist, that is an actual improvement in their daily activities. So this study is published. This study is not published yet, but it's waiting. We did a 12-week exercise also for the inclusion body myositis, where we used a single subject design, which means that it's in Swedish, I see that now, the phase A, it's like the phase A. You do several measures, and that will be the baseline or your reference value. So each participant were their own reference. And in the B phase, if you have 2 or more measures that is exceeding those lines that you see, there is a clinically important difference. So this is one person. So the key and the 3-jaw pinch was improved. So regarding hand exercise, we could, in conclusion, say that it's safe to perform. No one got worse. There were some individual improvements. In IBM, it's also safe to perform because no one got worse. We could see some individual physical improvements, but I think what was more striking in that study was that the patients were asked to, or the participants were asked to set up goals in areas that they wanted to improve, and rated their performance and their satisfaction before they started, and then again after the study was finished. And there we could see improvements, even though the physical improvements of the grip strength or dexterity were not as pronounced, but in activities they thought they improved. So something happened. So let's see on the time. So I hope you are convinced that hand exercise is important to do. I would suggest that you do both mobility exercise, and I would show you some exercises, or I will show you how to do it, and also strengthening exercise. I would say in poly and dermatomyositis or the others, mobility exercise for them is more maybe just to check that it works well. But on the other hand, strengthening exercise is good to perform. In IBM, I would say that it's important to also do the mobility exercise passively. Of course, try to do it actively with your muscles, but if it doesn't work, it's important also to try to maintain the joint mobility. So I say that it's good to do it every day. I understand that you have other stuff to do during a day, but if you aim for it, it's good. So this is just I mean, you can't move your hand in so many different ways. So this is, I think, the most important movements that you do. You go through your hands. So you move the wrist. You flex the fingers in different ways so that you will use all the tendons and all the joints. So number 2, I don't know if you see me, I guess 2. And then the 3, you flex these joints. And then the 4 is making a fist. Circles with your thumb and then go through the fingers. And in the end, you move the thumb because the thumb is important in all the grips that we use. Yeah. So in IBM, every day. In the others, if you don't have any problems, maybe once a week, just to check that it's still working. Because I think that you need to manage your daily activities. So it might be that you doesn't really realize that the mobility is affected because you kind of adapt. So it's good to have a check to see that it's still working. During the strengthening exercise, I don't know if you have seen the Borg scale. Direction is that after doing the strengthening exercise, the exertion should be on somewhat hard to hard to make sure that it's enough resistance in your exercise, or the resistance in the ball or dough or whatever you use is hard enough. So these are also the strengthening exercise, and of course you can do a lot of different things with your hands. I have chosen those grips that you usually use in your daily activities. Because I think you have other stuff to do than doing hand exercise and other kind of exercise. I mean, you have to can't take too long because you might not do it. So the first one kind of looks the same as the mobility exercise, but if you hold something that is a little bit heavy, or if you have like those rubber bands, or even if you just put the other hand on, you will get the resistance. The picture 2 is just to squeeze the ball. So what you should think about is that you don't overextend your joints, which could be a problem, because if it's too hard for you to squeeze, it's easy to just lose it. So it's important to put the fingertips into the ball. The other one is doing the circles again, but with a ball in between. The key grip is number 4, which we use, of course, for the key, but it could also be pulling up our pants, or a zipper, or now it's, at least in Sweden, we have those boots that are quite heavy to put on. Number 5 is the 3-jaw pinch that we tested in the exercise studies, which is also something that we use maybe when we opening packages, or yeah. And then the thumb, because we need to have the thumb strength. Yeah, I think that was it. So I will be glad to answer any of your questions, and if it was unclear.
I may, yeah, well, thank you, Malin. I really appreciate that. And there's a lot more exercises that people can do. She's picked kind of the important ones. And I think as we go through the questions and take some other questions, we can jump into some other things. Speaking as an IBM patient, I think I underestimated the importance of hand exercise, to be perfectly I'm sure Malin will love hearing a surgeon say that. But I would say that I underestimated it, and it's kind of pain. It was more focused initially on walking and getting in a chair, that sort of stuff. My hands, I probably neglected it, and I think as time goes by, I've realized the importance of it. As IBM patients progress, there's always things you can do. Okay, I would just emphasize that there are things you can do. You just have to do it. For me, for some reason, it's a hang up. I'd more rather try to swim or exercise, but I cannot emphasize enough the importance of doing it. So real quick,
and then also maybe trying to maintain the grips that you have. So, I mean, if you have lost some of it, at least try to remain as much as you can of what you have, because I mean, it's important.
Well, you don't realize it, right? Just picking up a glass now for me is too, I can pick up a wine glass that's have a stem, right? That I can scoop it from underneath. I have no biceps on my right, but I have biceps on my left. But I don't have enough grip strength to be able to pick up a glass. So I've got to do that two-handed, like my 18-month-old grandson, he and I are. But I would say that, like I said, underestimated through the years, and I should have pushed it. But you use it more than you put it like this. It's one of those things you don't realize it until it doesn't work. We'll just put it like that. So I think it's one of those. Real quick, before we jump into the questions, there was one question about a CAR T therapy, where obviously this is not, we're not going to talk about that today. But I would emphasize, appreciate it from Rachel. It's a great question. It's coming up all the time. There is a CAR T webinar coming up on January 28th. At 6 p.m. with Dr. Max Koenig. So you can get to the TMA website, which will have that information. All right, so the questions are pretty good. I tried to answer those that are, that were easy to go. So I'll just start. So Malin, is this a right or left-handed device? Would a person only need one or two? Both hands are weak. Yeah, it's a great question. So first of all, right or left-handed? We'll just start that first.
So you can have it on. So they're left and right hand gloves. So you can have it on either hand. And that was actually what some of them said during the conference, or in this pilot study, that they thought it might be good to have two. And I think, if I remember correctly, you don't have to have like two batteries, but you can add on the gloves. But still, I mean, it's so yeah, yes. I think you can have it on both, but it's still a thing that you have on your hands.
Were people with weak function able to pull it on by themselves? Because I can see that, like me pulling gloves on and stuff right now is a problem. Yeah. So did you find that was a problem or no?
Yeah, for some it was. So especially those that have had more difficulties, but still maybe the function in their upper arms.
Yeah.
So if they got it on, they could use it better. So of course, so it could be that you need the help to put it on, but I thought it was so nice to hear that it at least could increase independence. It's kind of what you were aiming for, and that was kind of like, oh, good, thank you, for something that actually works. Because I mean, even if you don't get independent, you still can increase and do some of the stuff that you want to.
Well, yeah,
instead of being
just to be able
dependent
to
on
grip a
another.
glass, right? Exactly. I mean, it wouldn't take much. Is it waterproof?
Yeah, it is. So,
Okay.
so the
Rechargeable?
questions, the fear of using it in personal hygiene, it wasn't really a problem. So I think the electricity is more in the battery, so it's not in the. So of course, but it's not the connections or the things. I don't know. It's not, well, yeah.
Oh,
it's not
that's
there.
great. And is it rechargeable?
Yeah.
Yeah.
Of course.
Good.
Yes.
And it was the same question I had. So I think it was whoever typed it in. I thought the same thing. Why did they pick the middle finger as opposed to the index? Do you know? Just intuitively, the index is what I use for pinch because my middle doesn't work very well. Just curious. Do you have any idea? It's okay if you don't. I don't know.
Well, I'm trying to remember if I heard why, but I can't really. I think they were thinking that it would be good to have one at least that didn't have the glove, because you want to, of course, you shouldn't put your finger in your mouth, but I mean, it could be something that you want to feel, and you have the sensation maybe more on the index finger. So that could be the.
Could be. Is there a certain amount of time every day that's recommended to wear the Carbonhand?
We don't have any of those recommendations. We in the study protocol that we wrote and that we actually have ethical approval to perform, I think we said like 210 minutes a week. But there is, so I would say it's not, I mean, the Carbonhand isn't really for exercise. It's more to improve the activities that you do. So we don't really have. So I guess, I mean, so what should the answer be? So I mean, if you use it a lot, you might be more tired in your muscle, even though you get help. So you might probably get some muscle ache, maybe after using it. So yeah.
But there's no real, so the purpose of it is to improve function, I think, right? So right. I mean, the idea here is that, you know, if you were going to go out to dinner or something like that, and let's say you needed help. So the key is jumping into the next question, which is you're not going to necessarily regain finger function by using this device, or it may, I mean, we'll put it like this. It's probably too early to put it like this. Meaningful. It's not like you're going to use this thing and use it for 6 months, you know, X amount of hours per day, and then all of a sudden gain, you know, your function of your hand back, correct? I mean, is that I mean, not that we've studied it probably, right? But the purpose of it, right? The purpose of it is to improve your function, you know, when you're using the device.
So there is a study in the Netherlands, I think, and I think there were actually one patient with IBM, but also with like, so that would be some orthopedic fractures that used it, and they improved their muscle strength. But then again, they had other what do you call it, abilities to improve, because it's not a muscle disease, it's a fracture. So I mean, they have seen that it could improve grip strength, but we haven't seen it in myositis. But so I think my hypothesis is that you might use your hands more because you could do more activities. And if it's only for the mobility, I would say it's still good, because you kind of maintain your mobility in your fingers.
Yeah, it's the second part of this question, which is, will this device make it more likely that finger-hand muscles deteriorate? I think the short answer is nobody knows, right?
Nobody
But I put it like this.
No.
I think if you use your hand, if it makes you to use your hand more, it probably is not a bad thing, to be honest with you. I think it would be, you know, so I think so you can tell me, I don't know the answer to that question, but to your point, Malin, I think it's like the more you use something, you're using your hand more to, you know, to grip and to do things. My sense is it's probably the net effect will be positive.
Oh, And maybe you feel better.
Yeah.
I mean, maybe your quality of life or your mental state
Yeah.
will be better because you
Yes.
are able. Yeah.
Another question. So it's a good question. So please address which muscles the hand activates. So I guess the question is going to be which muscles still need to be viable, right, in the shoulder or arm for the device to work. So let's say, yeah. So the question is going to be, yeah, which muscles would still need to be viable? Like I said, I have no bicep. I can bicep on this side. I have nothing. I got an abduct to get a bicep on this side. And also have no wrist extension or barely. But the question would be, well, yeah, which muscles still need to be viable in the shoulder or arm for this to work?
So I guess it depends on what you're doing as well. I mean, if the grip, if it would be, not that I would suggest vacuum cleaning, you don't have to lift up the arm as much, right? Because you would be. But so I guess it depends on which activities you're doing or using it in, or in which level of you want to use the hand. So we were thinking about, because of the wrist, if you don't have the strength, because it's a really thin
Right.
glove, so it's not a. So we were thinking about if you would add a splint to support the wrist, it might help just for the wrist, but still you need to have some kind of function of your upper arm. That's what we think, at least. So for the inclusion criteria for our other study, we will check the muscle function in the upper in the arms, just to see where it doesn't really work.
Yeah.
So we don't
Well,
really know yet.
and that's why it's hard to answer these questions, honestly, because every patient is so different. And just in even side to side, there can be tremendous differences, in the same patient. So it's hard
And
to
depending
answer
on
all
where
these definitively.
yeah, and depending on what you want to do with the glove or with your hands, or in what situations you want to use it. It depends.
Yep. Appreciate it. All right. So go ahead.
So we before we went to the TMA and tried it, we had 2 patients in Stockholm trying it. And they had, so one of those were actually picking up stuff from the dishwasher and also taking off the phone from the table. It was difficult to get the grip of the phone. So depending on what activities you want to do. So the glove have different settings. So if you have difficulty flexing your fingers, you can, there is a, like, just that it helps you just to get the grip, and also keep it so you can, so you don't have to kind of hold it if you don't want to, it just stays there. If you're doing something for longer time, you can use it.
Another good question, which I don't know the answer, is a Carbonhand compatible with a pacemaker?
Pacemaker?
Pacemaker, heart.
Oof, I don't know. I guess, I mean, it's like a phone isn't uncompatible with a pacemaker, or?
Yeah.
I don't think it's such a exclusive batteries thing, but I can't really say either. No, I wouldn't.
Yeah, it's a great question. My gestalt is just seeing the amount of current, like in the OR, if somebody has a pacemaker, we would, sometimes use Bovies or other things, electric cautery and I would bet this thing does not generate enough power that it's going to be an issue, to be honest with you, but that is pure conjecture.
Yeah.
And the hard part is your cardiologist isn't going to know either, because he's not even going to know, he or she's not even going to know what this is. So great question. And it's probably something we would have to direct back to the manufacturer, would be my guess. My gestalt is that the voltage here is so low, it probably would be fine. I mean, I don't even think the voltage that goes through here is, any more than like a heating pad, that realistically that's alternating current versus direct current. So my guess is no, but I think it's a great question. We would probably have to get the answer from the manufacturer.
Sure.
Would you agree with me there, Malin? I don't know.
Yeah, I do. Yeah, I do. I can't really say.
Okay.
No.
Okay, good questions. There's a couple of these here. DM. I have DM, and my hands, wrists, forearms have been significantly affected. So we're jumping out of the Carbonhand. I think I have a couple more Carbonhands in here. Let me just do this real quick. Since we're on the Carbonhand, I'll do that. I'll try to get those done first and then go from there. All right, Carbonhand. how's the device cleaned and maintained? It can get wet. Is it warranted? So I think that warranty would probably have to come from the manufacturer. So do you know offhand how they clean and maintain it?
Yeah, no, is
Okay.
my quick answer. Not sure.
I'm, I'm
I'm
sure they
sure it's
thought of
on
it.
their webpage, so you
Yep,
can find the information.
agreed.
Um,
And this is the biggie for those in the US. So I think for clarity, if you are a veteran, it is approved by the VA or has been approved by the VA. So the question for those in America, Malin, you may or may not know this, is it is not approved at this point by the FDA.
no,
Do you
that
know
is
if
what
there's any, yeah, do you know if there's any plans to submit it for approval?
I think there is. So I got some information from Annika that was on the, so she said exactly as you said, the veterans, and she said that there is something that is called limb lab. Is that does everybody know what that is? So they have a contact person, Macy Urban at Limb Lab. That she can screen and evaluate and supply Carbonhand for patients in the States. And the doctor has to sign the prescription and something. She is physically in Omaha, Nebraska. So I guess the Limb Lab, if you have questions regarding your insurance or otherwise the company, the bioservo.com, I guess.
Yeah. And so put it like this, I'm sure there'll be a lot of questions about that. So I'm going to kick that one back to Linda and Rachel to put that information, to try to get that information. So a doctor's going to have to sign it. I think everybody asked the question, there it is. Does it require a prescription? How expensive is it? The short answer is we don't know. This completely depends on your insurance. Okay, so there's the limb. So it's in the chat. I do see the Limb Lab. I do see the link is in the chat. So for those of you who are interested, you could connect there. So we'd love to give you the answer. There's just too many variables as far as insurance and et cetera, et cetera. If you are a veteran, then you can talk to your local VA. If you're not, I would, at least for starters, hit that link up there.
So I mean, in Sweden, we don't get it either as an assistive device. So I think some can get it in Sweden if they as a work assistive device for work, but otherwise not. And there is some other money paying for it. So in Sweden, it's like 60,000 kronor, which is the crown is really bad now. But if we should just, it's like divided by 10, so $6,000.
Okay.
But I'm not sure. So I guess they're. So in that amount, approximately.
And that's so multiple questions about that. I think once again, individual specific, don't know if there's a no insurance cost, that we can't ask. Another question about this before we do the general stuff. Are these gloves fitted for the specific hand? Do they come sizes? At the conference, they had no gloves there. So it must be either a small or a big hand size. So they come in sizes,
small,
I'm
medium.
assuming?
Yeah, small, medium, large, maybe extra small even, and extra large. So they have different sizes. They do.
Okay. But cost. Have any patients used the gloves in bed for pulling up covers, etc.?
Don't know. I haven't seen any of those.
Yeah. I mean, I think
studies.
you'd be able to do that if you wanted to, just grips. Covered. I think this is hitting all of them. Trying to get the Carbonhand before we jump into and then one last one on this. Can I be a test subject for your research?
Well, I need to get some money first.
Yeah.
So and I guess at starters we will try to do it in Sweden first. So but we had conversation with Hopkins, but we need to get the funding first before we can do it.
Yep. Understood.
Otherwise, I would be glad to have any of you doing the research with me.
Absolutely.
That would be great.
Yeah, quite. So are there any studies going on in the United States right now, Malin, that you're aware of?
No, not that I'm aware of, no.
Okay.
I don't think anyone has actually been involved in the Carbonhand more than maybe me, if I would guess, but or our team.
Okay. Do you know of anybody who has used it that would wear it all day? Is this something they would wear all day or not? Who knows?
I don't know. We have a patient, or the one of those that actually tried it in Stockholm before we went through, continue with the idea of the study, bought it, but I'm not really sure how much he uses, or I mean, so I would guess that you would use it in the activities that you need it for. So if that is all day, I guess it's not. I mean, you probably won't use it all day.
Yep.
But I don't know if it would be something bad or something that would be a problem to use it all day. But I guess you wouldn't, because you want to take it off once in a while.
Yeah, no, appreciate it. All right, last ones here are like that. These are sort of general questions, at this point. So first one, DM. I have DM in my hand, wrists, and forearms. Sounds like, unfortunately, are pretty involved. Thankfully, my doctors acknowledged this. But have you encountered? The patient feels. I were asking, well, it's anonymous. Thankfully, my doctors acknowledge this, but I feel rather unique. Have you encountered DM patients with hand, forearm edema, weakness, tenosynovitis? Basically, have you seen DM patients who have had what
also inflammation in the I have. So I mean, there are some of the myositis subgroup or subsets that also have joint inflammation, so they have also arthritis. So I think I have seen that. So, and I guess, I mean, then the treatment would be the same as we have for those with arthritis or the tenosynovitis. So, I mean, still continue to get the mobility.
And the next questions talk about that as well, but basically certain things trigger it. As I watch this talk, I mean, wrist wrap with compression support, which seems to be helpful or seems to be common. When it's worse, wraps it, ice, rest, usual smart things. Bicycling really triggers it, as does chopping food. Interesting at times during my work tasks. As also players, am I a unicorn? Nobody talks about DM and forearm disability. Patient does see OT regularly, and which is great. So I think the answer is you're not a unicorn. All right, no, I think it's more common than people believe.
Yeah. And I mean, there are different ways. I mean, of course, hand exercise, but you can also make the grips on your knife or the forks or whatever you're holding. So if you have a bigger grip on something that you use, you will have less, what do you call it?
I think your tendons are going to be, there'll be less pressure exerted on your.
So you don't so you don't have to. I mean, if you have a really small grip, you will use the muscles and also the muscles in the hand that are smaller and not that strong. So if you have bigger grip, and also if it's a little bit of a rubber, so you get a grip, you don't have to squeeze as hard, and that would also maybe decrease the problems that you get while using your hands. So I mean, like pencils with this, no, I didn't have any pencils. So I mean, with like this rubber thing, and if it's a little bit thicker, you don't have to use your muscles or the joints as much. And that would decrease the tension on your, or stress on your hand. So I mean, there are different ways that you can also adapt your activities during the day. Like you had like a wine glass. I mean, it's better to hold it.
Yeah, you can.
You don't have to grip that much. You can just put it on.
Yeah, you just have to hold it, right? Or if you, right, exactly. So same patient, looks like Malin. Yeah, same patient describing, interesting. Sounds like had a lot of edema, a lot of inflammation in her forearm. Had edema, palmar contractures, actually thickened fascia with nodules, was undistinguishable from Dupuytren's contractures, which are basically contractures of scar tissue that you see in the hand and palm that tend to curl fingers. My OT worked to soften, stretch, and provide exercises and stretches. Patient bought devices, maybe just you were describing. But interestingly, thankfully, once the methotrexate kicked in, so the patient had a immunosuppressant to help the disease process. Once that kicked in, strength increased, edema decreased, and the palmar contractures and nodules regressed. The question is so I think it speaks to two things. So have you heard of methotrexate doing this? None of my doctors have seen this. I think my gestalt, I think the question here is, you clearly had patient had clearly had an inflammatory process going on in their forearm, and she was forming contractures in the hand. And then clearly once she got on the medication and immunosuppressant, that the inflammation calmed down. To me, this speaks for, thank goodness you were going to an OT who was able to work through this during the period of the flare, because some people would just ignore it and then may end up with contractures. So I think none of the doctors have seen this. I can't tell you if this is normal for Dupuytren's or for dermatomyositis. Doesn't sound normal, but I think it's in the ballpark of it. You can see it, but I think you clearly this patient had a lot of forearm inflammation, which caused contractures. So I guess to that question, Malin, have you ever seen that? Any people like this who've had anybody with myositis who's had enough forearm inflammation and arm inflammation that they ended up with contractures? Or nodules? The good news for the patient, and they seem to disappear.
So that is good because I guess the OT is kind of just to maintain or kind of trying to keep the function going until gladfully or thankfully the medication works. Can't really say or remember, but I mean, as an occupational therapist working in the clinic, I see all the rheumatic diseases, so I see these as well. So
it does sound a little unusual. I would just say that this doesn't sound like the norm. But this is what we talked about before. Patients are different. Everybody's diseases are different. And I think it's a good thing that you were going to OT at the time to get through this. So, all right, another question I do see this. Well, the use of a TENS device question. So will the use of a TENS device help in maintaining muscle strength? If you could take a minute to talk about what's a TENS versus electrical stim, there's a difference. So I guess the question is, will the use of a TENS device help in maintaining muscle strength? That's the question.
So I don't use TENS at all because, well, I can't prescribe it and we don't have it in the clinic. I did try it on an IBM patient. I don't really know the difference between them, but so I guess the TENS is sending pulses, right?
Yeah,
they're trying to contract the muscles.
Yeah. So basically they're similar. Put it like this. You're basically putting electrodes. I did it for a while, where I would try it. You put some electrodes on my quad, right? So my quads were getting pretty weak. I was starting to have falls. You put the electrodes in the right places, and then it basically sends a low level electrical impulse into the muscle, which causes your quad to contract. It's the same concept. So I think you can say with the use of a TENS/eStim, you can get these honestly on Amazon in the United States. So this is what I found. Put it like this: is it helpful for really maintaining muscle strength? No. Walking, doing exercises, it's going to strengthen it. The only time I found it to be helpful was back when I was walking before the wheelchair, was when I had a giving out episode. So when I had I had a giving out episode in the fall. When I was walking and I had a giving out episode in the fall, I found let's say my right quad or my right leg gave out. I found I was more susceptible to a second giving out episode for like 3-4 days until I could kind of build my strength back up. So I did find the use of an electrical stim or TENS device in those 2 or 3 days to be helpful, because I could stimulate my muscle and start kind of waking it up. And then after a couple of days, it wasn't helpful. Once again, anecdotal, but it's nice. It'll stimulate it, but you're better doing the exercises that Malin showed you.
Yeah, I guess, I mean, it's also, I mean, that would be like a static, just a tension. I guess you want to have like the motion or the muscle flex and tense. So I don't know. I did try it on an IBM patient very long time ago, but she had too weak muscles. So it's kind of went to the other side. So she was more like extending the fingers instead of getting the grip. So no, I don't use it.
2 last questions. I would say one is talking about hand function. So I have full function of the right. So it's a patient who has RA in addition to IBM. It's a tough
Oh. Mm.
That's tough.
Mm.
I have full function of the right hand, but can only use the thumb and pointer index on it. No grip strength. So is it
Mm.
normal only on one side? So it sounds like we have full function of the right hand. I'm assuming you're talking about the left side. Yeah, I can only use thumb and pointer, i.e. index finger on the left. So very different. Is it normal? So the hard
So,
part here is trying to, yeah, determine how much of this is the rheumatoid and how much of this is the IBM would be my guess.
so I
I
guess
don't know.
when she says that she has this grip, it's kind of it's a usual grip for IBM, which is
Yeah.
so that is where you can end up. But so I think there is a study saying, oh, that was kind of the reason why we did the hand exercise study was that the dominant hand had better function than the non-dominant hand. So if the right hand is the dominant hand, it might be, but I don't know. And with the arthritis, no. So the question were, is it common? Can it be like this? Yeah.
It seems quite a different, like full function on one side and very, what you're describing, you described it perfectly, Matt. What you're describing is very limited, kind of typical IBM function in, on one. It seems very different side to side. I'm glad that you have but good function, right? So to answer the question, is this normal? No, but you do see, once again, spectrum of disease. I think that may be. Last question, which is a very good one, why I saved it because it's very common for multiple people with myositis, and this is beyond OT. This is into your PT. So I have difficulty getting up from a chair in a toilet seat. I'm not able to do the bridge exercise because my lower back hurts. Is there any other exercise I can do? Thank you. So difficulty getting up from a chair and a toilet seat.
So in an OT perspective, I would have
Yeah,
like
this is a little out of her. This is a little out of your world, right? Yes, that's
so that
okay.
then I would use like a razor, so it would be easier to get
Yeah.
up from the toilet and also from the chair, maybe a cushion. So you said what was the
So it's
exercise?
difficult to getting a chair and a toilet seat. I would say she can't do bridges or she can't do
What
bridges.
is bridges? What is that?
It's where you're supine on the bed and you're trying to, you're working on extension. So it's basically you're supine on a bed, a bridge. So you're on your back and then you try to
And you
push
try
up,
to lift your
push up. Yeah, you lift your butt off the bed,
mm.
firing, basically. I think what would help this patient would be you can do simple sort of lat isometrics. So basically you put your arms underneath you and you try to push your, in a seated position. You can do this side of the bed. If you're in a chair, you could do this in a chair. Basically, you're just trying to push yourself up off of the chair. Think about it. You're just recreating your functional motion. So if you can keep basically sitting in a chair, arms at your side, and then trying to push yourself up, contracting, as it's called, you can look it up. It's called lat isometrics. That's what that would be that's more PT. Malin's an OT, an expert on hand. So from the hand, and if you have wrist weakness, which is somewhat common with IBM, that can be hard, because you want it to, the more solid either your hands are pushing off, or sometimes you can make a fist and put it into there, but you need decent wrist. Yeah, you can kind of put a fist, but as your wrist extensors get weaker, it gets a little challenging. Then you got to go back to putting your hand on there. So, all right. So there you go. You did very well for all 30 questions. Nice job. So are there any other listen, I think no open questions at this point. I would say
so maybe the last remark would be that don't forget to do the fun stuff as well. So prioritize your meaningful activities, whatever they are in your life. So you also have this energy giving stuff that you can use and be happy.
No, thank you. Dr. Regardt, thank you so much. And really appreciate your time and all you've given us. It's not just in these webinars, guys. She has been a very true supporter of TMA, but also for the patient. She has been we're very lucky, obviously one of the most knowledgeable people in the world on myositis and hand function. So we are very fortunate that she's been part of our medical advisory board and hopefully will continue to be so and very soon working with us for years. So thank you so much for taking the time.
Thank you.